Rolling.
Yeah. Tell me more about you.
My name is John Kamara. I'm the founder of Africa, and I'm a technology enthusiast.
Sound interesting. So, what is this company? Why is it different from other HMIs?
Good question. What is Africa? Africa is the what I call the revolution in how we begin to manage patient-driven healthcare. We're a deep tech healthcare company focused on providing access to data to the patient, mobility of that data, and continuous use of that data across the rest of the ecosystem. So we're not a HMIS. We don't want to be HMIS. There's loads of people who do HMIS, and they're really good. But I'm going to ask you a very simple question. Anybody here listening to me, do you have access to your financial data on your phone? I'm sure you do, right? And if I ask you the same question, do you have access to your health data right this second on your phone to pull it up? 98% of people don't. And that is the most important data in your life because it could save your life. And that data, lack of that data, is what killed my friend. The reason why I feel like for me is a lifelong obsession. It's not a startup.
Okay. Tell us about the patient's portal and how it's going to change the health record management landscape.
So the idea of the universal patient portal is to say, how do we build a place, a repository that allows every patient to consolidate their health record, either from a hospital, from their wearables, or even from their devices if they're chronic illness. Because imagine going to a hospital every time you go to a doctor. You go from one hospital to the other. And if you meet patients with chronic illness, you see how they carry files around, just so to make sure the doctor doesn't make a mistake in their diagnosis because of how important it is. So we're saying, look, instead of having this on email, on WhatsApp, or everywhere, we're going to give you this thing of beauty called the Gmail of healthcare, basically to allow you to consolidate all your health record. And now you can use that same page to add the record of your kids. So as a mother, all your vaccinations, you store it properly, your kids know. And then at the same time, you can begin to use it to access healthcare services. You go to a hospital, you share with them your health data before they even actually start treating you. You finish up that hospital, you collect back your health record. You can add your doctor for a second. And if you do medical tourism, you go to India, everywhere, you ask them for your health data so you can own your health data. And when you own that data, you can provide for yourself efficient healthcare. And in Africa, where we have problem of limited resource and limited infrastructure, data to the patient, and the patient at the centerpiece of this is what, and there's so many EHRs, from Epic, HMIS, Helium, 360 Med, there's so many. But the only one person that is consistent in all that is the patient. And over 7 billion people in the world are patients. It's just when your journey starts with the patients.
Really? So how do you intend to achieve this, to add value to the lives of the people?
So basically what we're doing is we're launching our universal patient portal, which is our B2B platform, and we're B2C platform, and we are allowing patients, the first invited patients. We're focusing on a lot of chronic illness patients, cancer, diabetes, specific disease areas where people really do need to store their health record, track that health record, connect with their doctor to provide, and also the marketplace ecosystem that we're providing for them, and then allowing them that platform to begin now to curate, store, and have AI tools to monitor their symptoms to also help them track what they're doing, because Africa is built on geolocation. So we geolocate everything that happens, so you can also use it to monitor infectious type of diseases around the location that you're in. So we are going to provide that, and we have a tool called the Afia Box, where you can just send like a Dropbox to your hospital, and they can just put all your health record there for you. Just say when they email it to you, just one click of a button, and it's in your own personalized platform, your own personalized health platform that can connect you to the rest of the ecosystem.
So generally, what is the kind of the MOU you have with Voice of Nigeria? So how did that coming?
I think the Voice of Nigeria is a very critical part of what is happening to create a voice for technology in in Nigeria. So for us, having that MOU means that we can layer partnerships around solutions, partnerships to drive digitization, partnerships to also drive change across multiple layers, and obviously healthcare is a huge part of that. How do we help more Nigerians to have access, ownership, and use their health data to basically provide better healthcare and reduce the cost of infrastructure. And because this thing is built on the blockchain, it's compliance. So around HIPAA compliance and all the compliance metrics and privacy that we do because of the high level of technology. So Voice of Nigeria MOU means we can really evangelize together about patient-driven healthcare.
Okay, so that's also transcends to each of these media startup, or the startup generally.
Absolutely, and again, the same MOU allows us to work with Voice of Nigeria across all the startups that we have in Nigeria, and what we're about to do, even as we want to train developers in the country, as we want to provide more capacity, and also as we want to help a number of organizations also get digitized as well.
So what's the choice for Voice of Nigeria?
I mean, the choice of Voice of Nigeria, when I think about history, history is a very important thing. And earlier on, I talked about how corporates and startups should function together because they think that, corporates want it. Voice of Nigeria is part of government. Okay? But also, more importantly, it has been one of the fibers of media and communications in this country. And that you can't take away, and you can't buy that. And for us, we believe that partnership with an organization like that could really help us show how we can accentuate this drive for technology revolution. That's why we chose them, and that's why they chose us.
Thank you. John.
Good?